My name is Jenna Presto. I'm one of the investigators on the study Computerized Planimetry to assess clinical responsiveness in a phase 2 randomized trial of R333 for discoid lupus erythematosus. We did this study because JAK-SIK inhibitors have been shown to be beneficial in animal models with inflammatory disease. Therefore, we wanted to determine if a topical JAK-SIK inhibitor could be used for the treatment of discoid lupus erythematosus lesions. In addition, individual lesions often present a challenge in terms of severity assessment in clinical trials. Therefore, there's a need to validate an approach to evaluate individual discoid lupus lesions in topical therapy trials. This phase 2 randomized trial looked at R333, a topical JAK-SIK inhibitor, and compared it to placebo ointment. 54 patients with discoid lupus were randomized to the experimental drug or a placebo ointment in a 2-to-1 ratio. The primary endpoint was the proportion of patients achieving at least a 50% decrease in erythema and scale at week 4 using the lesional CLASI. Physician global assessment and length by width measurements were also recorded. The primary endpoint for the study was not achieved, and while the topical JAK-SIK inhibitor R333 did not result in clinical improvement by week 4, this pathway still remains to be an important target for autoimmune diseases. After the trial, we wanted to evaluate an approach to evaluate individual lesions. Therefore, we used 88 photographs, 44 photographs taken pre-treatment and 44 photographs taken post-treatment. And using these photographs, we assessed change in lesion size using a technique called computerized planimetry and also using physician-assessed area change. Inter-rater and intra-rater reliability were assessed for these area measurements. We found that computerized planimetry demonstrated excellent inter-rater and excellent intra-rater reliability. There was also a strong correlation between physician global assessment of area change and percent area change using computerized planimetry. There was a poor correlation, however, between physician global assessment of area change and area change determined by length by width measurements. Therefore, computerized planimetry is a reliable technique for measuring area of individual discoid lupus lesions. It's better able to assess clinical response to topical therapies for discoid lupus lesions as compared to two-dimensional areas. In some cases, area of erythema or scale may increase or decrease, but the characteristic color and appearance may remain the same. As a result, it's important to look at area for topical studies in discoid lupus, and computerized planimetry has important implications for these future studies.